the ASHTANGA Ayurveda. The 8 branches of Ayurveda, Acharya Vagbhat gave this concept. It is known as ASHTANGA because it has 8 branches or 8 major divisions of Ayurveda. Each branch has its specializations, thus ASHTANGA Ayurveda are specializations of Ayurveda. Kaya Chikitsa, Bala Chikitsa, Graha Chikitsa, Urdhvanga Chikitsa, Shalya Chikitsa, Dunstra Chikitsa, Jara Chikitsa, Vrisha Chikitsa. Sushruta's chronology of ASHTANGA Ayurveda. Shalya Tantra, surgery, Shalakya Tantra, Antonize, Kaya Chikitsa, general medicine, Bhutvidya, same as Grahya Chikitsa mentioned by Vagbhat, psychiatry, Kumarya Bridya, same as Bala Chikitsa mentioned by Vagbhat, pediatrics, Agata Tantra, same as Dunstra Chikitsa mentioned by Vagbhat, toxicology, Rasayana Tantra, same as Jara Chikitsa mentioned by Vagbhat, geriatrics, Vajikarana Tantra, same as Rishya mentioned by Vagbhat, aphrodisiac therapy. Kaya Chikitsa or general medicine is one of the 8 branches of Ayurveda, ASHTANGA Ayurveda, and deals with general medicine and management of various diseases and disorders related to the entire body. It is the first branch of ASHTANGA Ayurveda which mainly deals with the diagnosis and treatment of various general health problems. Kaya also refers to digestive fire, or Agni. Ayurveda believes that the imbalance caused in our digestive system is the root cause of multiple diseases. Hence, the Chikitsa also involves correcting the digestive fire, or Agni, to restore good health. The most important and authoritative work on the branch of Kaya Chikitsa, and for that matter the holistic science of Ayurveda, is the Charaka Samhita, put forth by the sage proponent of Ayurveda Rishi Charaka. Charaka Samhita is the theoretical body of knowledge of the science of Ayurveda with a focus on Kaya Chikitsa. Charak Samhita deals with the aspect of medicine and the non-surgical arm of Ayurvedic treatment, including personalized diet, hygiene, lifestyle regimen, and overall health. The treatise discusses the root cause of diseases, diagnosis, human anatomy, sense organs, physiology, modalities of the treatment and panchakarma, the 5 cleansing processes, and basic principles and therapeutics in Ayurveda. Bala Chikitsa or pediatrics refers to the branch of Ayurveda that deals with diseases of infancy, childhood, and adolescence and their treatment. It also mentions the quality of wet nurses, causes of vitiation of breast milk and modes of purification of the same, diseases due to intake of vitiated breast milk, and their treatment. Bala is the term used to describe infants and children, therefore Bala Chikitsa, which is also a synonym of Kumara Bridya, means treatment of children. The root of Bala Chikitsa or Kumara Bridya goes back to a sage by the name of Kashyapa, who was one of the pioneers of the school of pediatrics within Ayurveda. His disciple Vriddha Javaka helped document and encode his master's knowledge of pediatrics within a well-known text called Kashyapa Samhita. Children or infants, unlike adults, cannot express their complaints. Their dosages are different from that of the adults, and the medicines need to be tolerable for their bodies. These differences necessitated a separate field of medicine within the ambit of Ayurvedic sciences called Kumarya Bridya, or Bala Chikitsa. Bala Chikitsa is the pediatric offshoot of Ayurvedic science for healing that details disorders, treatments, and dietary recommendations, natural and herbal remedies for various diseases concerning children and infants, such as digestive disorders, teething problems, bone health, and nutritional requirements, among others. Graha Chikitsa, it is a branch of Ayurvedic treatment, which is mainly concerned with diseases acquired or inherited from apparently unknown causes. This branch of Ayurveda specifically deals with diseases of the mind or psychic conditions, which can be caused by supernatural forces or the invasion of some evil spirit. Different experts have explained the word bhut differently. Some experts say that bhut means ghost, and similar bad spirits that cause abnormal psychological conditions. It includes the treatment of diseases caused by many spirits and unknown supernatural forces like Deva, God, Daitya, monster, Rakshas, demons or evil spirits, Pisachi, flesh-eating demons, Pitru, ancestral forefathers, Gandharva, skilled singers from heaven, Yaksha, demigods, mischievous and sexually aggressive spirits, and Naga, semi-divine beings, half man, half snake. It includes planning and implementation of treatments and remedial measures in the form of the Shanti path, measures and methods to calm and pacify the above said gras, baladun, sacrifices, havan, fire sacrifice and other rituals, etc. to the diseases caused by various gras as and when required. Others say boot represents microscopic organisms such as viruses and bacteria that are not visible to the naked eye. In modern terminology, it can be considered an idiopathic disease in which the exact cause of the disease is unknown. The concept of Ayurveda also believes in the past karma or deeds as a causative factor of certain diseases. Ayurveda deals with the causes, which are directly not visible and have no direct explanation in terms of tridosha. In most cases, illness is caused by the disturbance of the mind, where Raja's passion and Tama's ignorance are supposed to be the contributing factors. These problems can be related to modern psychiatry. Urdhvanga Chikitsa or Shalakya Tantra or ophthalmology, and Ent is the branch that deals with the treatment of diseases in the areas above the neck such as those confined to the eyes, ears, nose, oral cavity, mouth, teeth, gums, and throat. Acharya Nimi, king of Vidya, is considered the father of Shalakya Tantra. It also includes the study of shalakas, instruments and types of equipment used to examine, diagnose and treat the diseases occurring in the head and its structures, sense organs and neck. Shalya Chikitsa, many would be shocked to know one plain truth. It was the Ayurveda of ancient India that pioneered the modern concepts of surgery. Well, Shalya Tantra is a vital branch of Ayurveda, the literal meaning of which is the removal of an irritating factor from the body through operative or surgical means. From Sushruta Samhita, it is known that thousands of years ago, very sophisticated methods of surgery were employed in India. Sushruta's original text discusses elaborately on a myriad of surgical methods that include how to handle different types of tumors, fractures of bones, internal and external injuries, complications during child delivery, and obstructions in intestinal loops. Sushruta was the first ever surgeon to develop cosmetic surgery. The use of numerous surgical instruments is explained in the Sushruta Samhita as well. Instruments were either made from wood, stone, or other such materials. Damstra Chikitsa or Agad Tantra is the branch of toxicology in Ayurveda that deals with treatments and prevention of toxins in the body. It has a context of time to it. Before modernization took over, and there was more wilderness around which humans lived, getting bitten or attacked by animals, birds, insects, or worms was common. So the studies of medicine evolved to provide a solution for deadly poisoning that resulted from these incidents in the form of Damstra or Agad Tantra. It deals with poisoning from animals, plants, vegetables, metals, or man-made poison. But more importantly, this branch of Ayurveda also considered air and water pollution as a form of poisoning that needed to be purified for the health and well-being of man, as contamination would often lead to mass-scale epidemics. Ayurveda accords as much importance to purity of air, water, earth, and space as much as to the food, environment, and quality of life. The practice of Agad Tantra is very ancient. Agad Tantra originated from the College of Toxicology, which Kashyapa established. Agad Tantra deals with natural and artificial toxic substances and poisons in detail, along with their antidotes, the signs and symptoms, and the management of poisoning resulting from the bites of animals like snakes, insects, spiders, and rodents. Nowadays, Vyavhar Ayurveda, medical jurisprudence, is an integral part of Agad Tantra. Rasayan or Zara Chikitsa, this branch of Ayurveda deals with diseases and illnesses related to aging, as well as the science of longevity and rejuvenation. It deals with preventive healthcare, tips, treatments, and herbal medicines. Rasayan to enhance the quality of life and lead a healthy, happy life full of vitality and vibrancy. Zara Chikitsa, Zara meaning degeneration, also deals with degenerative disorders irrespective of one's age. This Ayurveda branch talks about different types of rasayans like Ausadhar rasayan, drug-based, Ahar rasayan, dietary, and Achara rasayan, behavioral discipline. Zara Chikitsa includes healing modalities to achieve longevity, better memory, youthfulness, brightness, positive emotions, virtues, strength, immunity, and vitality. Rasayan works to improve dosha imbalances, rekindle digestive agni, and restore health with the use of diet and herbal medication. The focus of Ayurveda is not just to mitigate symptoms, but also focuses on keeping illnesses away. And Rasayan Chikitsa or rejuvenation therapy is one way Ayurveda achieves this goal of preventive care. There are 3 sub-branches of Rasayan Chikitsa: Naimatika Rasayan, curative rejuvenation, Ajasrika Rasayan, promotion of health and a healthy lifestyle, and Kamya Rasayan, longevity, fertility, and memory enhancement. Vrishya or Vajikaran Chikitsa, according to Vagbat, the agent which induces euphoria in sexual activity, and the male partner performs like a horse, is known as Vajikaran. Some medicinal agents increase the seminal level, and some help in proper erection and vitality. Some ignite the sex desire, sex stimulants or aphrodisiacs, and some have astringent action on the seminal fluid. This branch deals with the promotion of sexual health of men and women and improvement in fertility. It focuses on the health and illnesses of reproductive or genital organs. It is a branch that talks about sex, virility, potency, strength, excitability, techniques, regimen, diet, herbal medicines, and treatments to take care of reproductive organs and diseases such as sexual dysfunctions, infertility, premature ejaculation, and erectile dysfunction. Isn't it amazing that this classification of Ashtanga Ayurveda over years ago is still on?